Thank you for joining us for the Oxford Internet Institute's Wednesday webinar featuring Dr. Bernie Hogan and Dr. Adam Maddy, Research Fellow at the Institute of Biomedical Engineering and Research Associate at the Oxford Internet Institute, University of Oxford. A little housekeeping: we are fortunate to have a varied audience with a wide range of views, and we request the opinions of others are respected in this space. For your awareness, this event is being recorded and will be posted on our website following the event. There will be time for a Q&A session at the end. Please do pose any questions using the Q&A tab at any time and keep questions as concise as possible. These will be visible to all attendees and we will endeavour to follow up any unanswered queries. Please allow me to introduce our speakers today, Bernie and Adam.
Hi, everyone. My name is Bernie Hogan. I'm a senior research fellow here at the Oxford Internet Institute. I'm also the program director of our master's program in social data science, and social data science will figure quite centrally in this talk. My colleague Adam Maddy will come in after the end of this presentation here, as I'll carry the torch over to his. First, however, I'd like to get started with this, and we'll play that just right now. Going to share my desktop here. Oh, don't want to spoil the surprise for anyone. Here we go. And I'm gonna sort of minimize my screen here so that we oh, just 1 second. Let's do this. In fact, I will instead share Keynote. And very good. So hopefully everyone can see the screen there and see this presentation. Indeed, that's my introduction. I'd like to start off with a poll. If possible, we could have people sort of reflect on this poll. It's just a couple of questions about data quality, and your interest in data related to COVID. These questions here, of course, are related to the ongoing and very complicated matter of how we track and how we participate in the tracking of COVID and coronavirus data. So this talk here is partially a reflection on some of the real complexities that are involved in this. And to also later on, we're going to think about ways in which we can and should participate in the analysis of this data and in the insights that come from the analysis of this data. So it's my first time doing an online poll. I'm going to assume that we're going to leave this open for just a little bit longer and see what the results are of this. Okay, wow. I mean, that's certainly very unambiguous results here. We do believe, many people here believe that the reported death numbers are an underestimate and that there is a strong but not urgent sense that data on COVID is a public health matter over privacy concerns. Now, to start off, I want to just give you a little sense of social data science as a science. Now, a lot of people have maybe some misunderstandings of what's data science, and so I want to point out that data is the plural of datum, and it's a mass noun as well. So we don't normally talk about data as as a single data, a data, and we don't talk about data with plurals. But anyway, science, of course, is a systematic inquiry of this sort of stuff. And I want to reflect on that. Now, if I could just have one moment of people's time here. My mouse appears to have disappeared. Okay, great. There we are. So we should see data science not as like a lesser, cheaper version of statistics or machine learning, but rather think about data science as systematic inquiry to map onto phenomena. Now, if you'll pause, if you can bear with me, guys. I have Zoom on the side of my screen here, so it's really, really doing some interesting stuff here. We're all learning as we go. The important thing here is to imagine that data, of course, is social, and social measurements are themselves really important, but also really complicated, because social measurements enable us to learn about the world, but we must ask who learns, how do they learn, and to what extent can we all learn together? Data science isn't neutral when it represents the superimposition of measurements onto people. And that, of course, is a matter of real public urgency right here. And we're now reflecting on whether that urgency leads us to do things with data that we maybe didn't do before. So I want to first reflect on the merit of national comparisons. This has been a subject of real controversy for a number of people. So we see here, this is one of many, many, many charts that has been produced. I quite like this one. This is from Reddit's Data is Beautiful. The bars there are normalized by national estimates, and we can see very tragically the peak there for Belgium. And we might wonder what's happening there versus the UK, which had a very steady drift forward, whereas others may have had a peak and then drop down. The importance here is not to give us a league table, but actually to reflect on these numbers and what they might represent. So now I'm actually going to skip over the video of this right here now, but this is Wajia Jiang. She's a correspondent in America, and she asked Trump, why are these league tables important? Of course, Trump gives a very hostile answer, as has been noted, and canceled the press conference. And that happened earlier on this week, which is to say that data and the estimation of data has been a way in which tensions have run pretty high for a lot of people, and that we still don't have a lot of certainty at the national or international level. Now, with respect to that, in the UK, Professor Spiegelhalter has been particularly instrumental in helping to bring some insight in this. And one of the things that he's noting is that, every country has a different way of doing this, and the numbers are useful as trend, but not necessarily as indicators at absolute levels. So he's giving us some real reflections on, how do we learn on this? Where can we use this? And where is it or isn't it appropriate? I mean, at the very least, we have to think about normalizing this data by the population. But even in that, we also have to understand that within that, those numbers are recorded differently by different countries, and that the outcomes may be different for different countries for a variety of reasons. On the right here, we can just see average deaths per day, and these are the sort of peaks. And this again is another chart from the ever bountiful, but perhaps a little bit quick to shoot from the hip. Data is beautiful. So now, similarly, in the past week at Prime Minister's questions, the opposition leader Keir Starmer had burst onto the scene with what some had called a forensic or otherwise very forensic or otherwise very careful or methodical takedown of Prime Minister Boris Johnson's comparisons of numbers and asking where did the UK go wrong. Now, of course, the Boris had then used, sorry, the Prime Minister had then used Professor Spiegelhalter to say that, well, we can't really compare these different numbers between different countries as a way of kind of perhaps dodging the question or undermining that. And that, of course, is not entirely accurate. I mean, we do really need these numbers, but we need these numbers with caution and with sense. And so, of course, he tweeted there subsequently saying a polite request to please stop using my Guardian article to claim that we cannot make international comparisons yet. I refer only to detailed league tables. Of course, we should now use other countries to try and learn why our numbers are so high. And in this sense, we get a little closer to the understanding of science, and science as a practice here. We're not this is really not a competition. This is a heartbreaking situation for a lot of us and a lot of our loved ones. But we need to learn from each other and learn what works. Within country comparisons and other practices will be essential for that. Now, I wanted to turn here to a statement that came across my desk from my colleagues at Northwestern University. I myself am involved in a contact tracing effort, although only peripherally. And within that contact tracing effort, we've been learning a considerable amount about data quality. Now, this is Professor Ronald Ackerman, who is the head of the Institute for Public Health and Medicine. And he says, here's some things that are worth pointing out in this email. This is a public email that he's sent out. And you can see the URL down below there. First, no state in the US is performing population screening for COVID. And this is to say, relative to earlier work, when we think about, say, polls for politics or national values, we tend to use random samples. We tend to think about this in terms of generalizability, but instead, with COVID, there's been an extensive amount of selection bias in this sort of testing. And that selection bias really varies by state. It also varies by country, and it even varies by hospital. There's also the matter that cleaning this data is a real trial. The data is reported in a variety of different ways. My own partner is a data administrator at the National Health Service, and even down to the different departments. Some will use Excel, some use other forms of software. It's tricky to know my partner's not related to the COVID data efforts. Now, with that, that means that there will be some considerable lag in actually getting accurate numbers, and there will be noise on a day-to-day basis. What we really want is to ensure that we're not rushing in order to follow these numbers in such a way that we can, that we're trying to race up or race down. The general trends are essential, but we don't need to see these with that level of granularity because the precision is simply not there. Now, of course, that's led to another consequence for this, and one that has raised some hackles, but it has also become a matter of public importance. And that is, to what extent can we consider alternative data sources to understand and forecast the spread of the virus? And this, at the moment, is and will continue to be for quite some time a matter of debate about what sort of alternative sources are appropriate, how to collect those alternative sources, and under what circumstances can we think of that data as either valid or reliable. Now, in this, in Ackerman's message, he says, one interesting idea has been to track the effects of social distancing more directly by using continuously available spatial data from sources such as smartphones. Now, of course, we've been doing this in the UK through the NHS X initiative. There's been corporate initiatives in that matter, and these are not, one might say, universally loved, nor are they considered to be universally valid. They have led to a lot of very interesting insights, such as the considerable decrease in mobility for most members of the population vis-a-vis the smartphone metrics. But that doesn't give us the same level of granularity of data that we might want with respect to who does one actually come in contact with. Bluetooth receivers between phones is still itself only a proxy. And this is really the main trial for this, is that a lot of the data that we have, unfortunately, is only proxy data, and that we must be very cautious in how we use it. So now, I myself draw a lot of inspiration from this book, and I actually have to thank a former student of mine, Bethan Charnley, who studied under these professors at Cambridge and introduced me to it. Really fascinating work here showing that throughout history, there's been a real tension between state actors as seeking registration as a democratic process. This is us signing up for things, voluntarily participating in the state, versus enumeration, which is often where the state will superimpose itself onto individuals, and this tends to be more authoritarian. Now, that's not to say that it's absolutely the case. All states construct populations in some way or another. We can see this through stuff like Scott's magisterial work, Seeing Like a State. But the important matter here is that we have to hold in tension registration as a voluntary act and enumeration as an imposed act. Now, this might be interesting to individuals when we're thinking about attitudes or politics or democratic voting, but what about a virus? A virus itself doesn't really respect national borders, and it doesn't really have much of a subjective attitude here. It is imposed on a population. So this has led to a number of states thinking that, well, as a consequence, the virus is out there and it's a matter of public urgency, so we must impose on others. Now, the problem, of course, with that is that, as we know, people don't really appreciate that sort of imposition. So there's different national approaches here. One, for example, by India, it says here, and this is from the MIT Policy Review, or sorry, Technology Review, very, very, very recently. It says, suggesting that India is forcing people to use its COVID app, unlike any other democracy. And this, of course, conforms to the sort of claims that we had just seen on the last one. And now, on the other hand, the UK has enacted a contact tracing app via NHSX. And within that, itself is voluntary. People ought to download it and give their information. But of course, there's a lot of uncertainty, both in terms of the usability of that information and its data security. There is now an assertion that if you do volunteer this information, it will be available for research purposes. But I want to give an appeal to people that research purposes are indeed quite valid for this. However, it's not my place to assess the privacy or data security of this. That's something that colleagues of mine have been meticulously interested in. Most recently, Michael Veal, a colleague at UCL, has been remarking on the problematic nature of this data. So here's an example of some of the tweets that have happened here. And now this one came across my my Twitter feed. This is a chap named Matthew Lowe, makes lovely lovely handicraft jewelry, and he's not sure how it's going to work for his grandparents that have an old flip phone. And this is the NHS app. Of course, now Dr. Chris McLean similarly has politicized this app and is quite concerned about what's happening here. Designed by, quote, and profiting from a mate of Dominic Cummings, who led a campaign vilified. Now, this of course is the opinions of the people who are tweeting, not mine, but it highlights how this data is not neutral and that it does get mediated by politics, even if we just want it for data quality. Of course, now some are reacting to this with aggressive and defiant poses. And now it seems it's my duty to download a tracking app, which itself undermines this as a national effort. And finally, we must consider that these apps are not mere neutral actors, but also mediated by the design and expectations of those who build them. And so the time it takes to download the app, to configure it, may in fact not be ideal for those who are the most vulnerable or not the least technologically savvy. So this isn't the first time we've done contact tracing, and I myself have actually been participating in contact tracing efforts pretty much since my PhD, although we didn't really call them that then. I'm a sociologist by training, and I'm trained in social network analysis. So this is a recent article that I've published here and on a tool that I've been working on with my colleagues at Northwestern called Network Canvas. Network Canvas, for what it's worth, was not designed for rapid response pandemics. We have discussed its relation to Ebola previously, but we've been more interested in HIV with this. And the reason is that HIV, of course, we can't necessarily just get this data from contact data. It's too sensitive, it's too private, and it's too complicated. And so what we've been doing is exploring how different forms of design and different forms of practice in the interview lead to what we ideally think is a highly reliable data. And I just want to say that part of this really reinforces that earlier sort of macro political stuff that I was talking about, that when we design for what we refer to as co-participation and empowerment, what we get out of this is a series of respondents who take ownership of this data and they feel that they're part of this process. For what it's worth, this app is designed as an interview app. And so with the interview app, the idea is that the interviewer will be collecting the data that's only self-reported from the participant and not trying to do that on the participant's computer or in other ways that in some sense may disempower individuals. I'm proud to say that we've got very highly reliable data across many waves and a very extensive level of retention in our earlier studies using Network Canvas. Now, for what it's worth, we're really proud that Howard Brown Health and the University of Chicago have now been partnering with us, and we're working like stink to get a version of Network Canvas available for the Howard Brown Health contact tracing initiative. So with this said, should we or shouldn't we? Should we or shouldn't we be collecting this data? Under what circumstances and how? Well, I mean, we should, but carefully. So I want to think beyond surveillance and think of the myriad approaches to understanding COVID. Now, the first one I want to talk about is the fact that we do have scientific insights already on this that don't require pervasive surveillance activities. I really am a proponent of this particular blog post by by my public health colleagues at the University of Washington, Steve Goodrow and his lab. And so that's at StatNet. And they show how, just like the 6 degrees of separation that we're all really close to each other in the world and surprisingly close, it illustrates what happens when we cheat just a little and see just one friend. And in fact, it gives very persuasive visual examples of how just one friend can be a real problem. And it does help to reinforce some of the public shaming or concerns that people have had about seeing certain members of the public or certain politicians just cheating with just one friend. And the problem is that just one friend is still perhaps too much if we're not too careful. The other matter is sampling. We see very little actually about what are the appropriate random samples needed for this, and instead we have a very extensive level of selection bias in our tools. Self-reports are really important as well. We can't really underestimate the possibility of self-reported data being able to draw people in and let them feel that they are a part of this process rather than the process is being imposed on them. And finally, there's the matter of triangulation with existing data and other kinds of data that have been previously collected, incidental data, traffic data, hospital admissions, and weather patterns. So with that said, when the data is ready, we want to be there. Now, Professor Spiegelhalter had mentioned this in his Guardian article to say, unfortunately, it seems like we really won't be able to understand exactly what's happened until we're very cautious and very careful with the data cleaning and able to triangulate with a variety of sources of data as they come online and are available for use. Now, to that end, my colleague Adam Maddy has been very proactive in collecting, aggregating, and cleaning these sorts of data so that we can now get some rapid ideas of what's happening, do some comparisons both within and between countries, and also being able to update this data as the data itself gets cleaned. So I want to turn over to Adam now, and so so we can hear from him.
Thank you very much, Bernie, for this excellent talk, an excellent introduction. I'm going to share my slides and just talk for a few minutes about this initiative, this project, when we try to clean the data and assemble a database. I have just a few slides to show. And let me just start. I hope you can see those slides on your end.
Yes.
Thank you very much. And so this is Oxford COVID-19 data projects. The objective of this project is to try to collect a very clean data related to COVID-19 with a goal to understand global impact of COVID-19 using the tools we are very used to, the data science tools, such as machine learning methods, mathematical modeling, or statistics. Many people contributed to this project, and I will mention that as I go. But let me start with something else. With a sort of, many people feel that there might not be lack of information on COVID-19, but rather there might be an overwhelming amount of this information that one is a bit lost when it comes to the every day we are bombarded by so many different news and information from many countries. At the same time, as the pandemic developed, the ways countries share the information has changed. And then we started seeing very, very different ways of sharing this information. The two extreme perhaps are Italy, when they use GitHub and very well organized data, which is very convenient for data scientists to start understanding the impact perhaps for Italy. On the other hand, we have countries when the government just tweets information about the current cases, the deaths, and then enthusiasts collect those information and publish them most likely on Wikipedia and other repositories. So there's this huge variety of ways of sharing this data. Despite this wealth of information, many questions, fundamental questions related to COVID-19 remain unanswered. And this is one of the motivations for this, to start this project. There is this, so we would like to have a reliable, in a sense, reliable information, but we, at the same time, we are aware of the 80-20 principle, where the vast majority of our time goes into cleaning and preparing data, and a small fraction of it is dedicated to the actual analysis. Let me just go a little bit deeper into the project, what we are aiming to achieve and what we have done so far. So as we said before, our objective is to understand the global impact of COVID-19, but for that we need a good and reliable, well-formatted and easily accessible database. Now, on the country level information, we feel like there is enough information, and WHO and European, for example, Center for Disease Control, they've been collecting and providing this sort of information. However, on the regional level, this information is very scattered and is presented in a in a variety of ways, very difficult to sort of gather together, to put together and to analyze. At the same time, a number of very interesting and very useful domain-specific initiatives have been launched. For example, here in Oxford, at the Blavatnik, we have a group who've been a very nice and useful project when they tracked government responses to the pandemic, providing information on a country level when there was a restriction when it comes to movement of people, financial restrictions, etc. So all this information is there. Google and Apple provided community mobility reports, and there are many other, including OII, when there are projects on misinformation. However, what we are trying to achieve is to have a unified database to take all those sources of information in a centralized and build a relational database that we data scientists are used to using, and to start answering important questions that we would like to tackle. Now, going even deeper into what we've done over the last 2 months, there have been 14 people working on it at different time. Currently, there are 10 people working on this project full time. And what we did, we built a relational Postgres database with an initial version of API and at the same time CSV files. These include 5 main tables. Tables on epidemiology, tables on government response, mobility, and country statistics. I must say here that many institutions responded incredibly positively in providing data, in helping us to format this data. Some element of it turned out to be quite a time-consuming process. So we built fetches that take this data exactly, format into the schema that we would like to have, and the database, so it's prepared for people that would like to use it. These fetches are updated daily. There are still a lot of work remains to be done. Let me just show you a couple of things. And one thing I want to say is that we are fairly close to launching the first version of it. So soon we will be sharing all this information with the public. Just at the same time, information. So let me just, in just few words, describe, tell you that there are various institutions that donated the data, as I started saying, such as World Value Surveys, including IBM is in the past donated data on the weather, as Bernie mentioned in his talk, as the valuable source of information. This is important since when we want to model things related to mobility, the obvious confounder is the weather. So we need things on the surface not very related to COVID, but they are very strongly related when it comes to modeling. So what can we do when it comes to what sort of things can we show? Things many of us have seen or see every day, country level information, but this project, in this project, we want to go beyond that. We want to overlay various types of information on the regional level. This information, it's not easily accessible, and this will allow us to answer a little bit more detailed questions, combining various sources of information. Instead of just describing everything, let me just focus on one graph. Let me just show you one graph that allows us to sort of overlay. At the moment, we're not answering any question. This is only, we are providing data, and we are relying on you to come and start using this data and answering some big questions that we need to know. So what sort of data do we have? We have in this graph, we are plotting information, the typical information on the epidemiological information on confirmed cases, the blue line. We have the red line, the number of people that died, recovered. This we see all the time, but also government response information and mobility. For this particular one that comes from Google Mobility, we see that this is the transit station, so number of people or relative change in the number of the volume of people going through the transit station. And we see that at some point it dropped significantly. And this coincided with this cross here. And obviously and naturally, this is coincided with closing public transport. Now one can start think and try to build research questions here and answer them. One thing I want to say here is that this type of information we have not only on the country level, but on the regional level. So there are admin division 1, 2, 3. So from a bigger regions to going to a smaller. And then we can start comparing things within a country, but also between countries. And overlay, at some point, we will also have the weather information on top of that, and other types of information coming from the World Survey Values and the European Survey Values and other sources that especially social scientists would be interested in answering. So this is in a very few words, the project where we're going with it. We are hoping to launch it in the near future. And if you found it interesting, you want to perhaps get access to this data or get involved, please get in touch. Here is my email, and I'll be happy to answer any questions or perhaps get you on board on this project. Thank you very much.
Thank you very much, Adam. And so that concludes the presentation portion of our webinar here, and we do have time for, as planned, time for questions. So we have a number of questions here, and I was going to moderate these in order, some of which we'll be able to answer. I've been reviewing these, some of which, unfortunately, we won't be able to answer. I'm going to try to read those out as we go along. And so the first one is, what do you think of how different countries count deaths? The UK seems to count any death with COVID as a death. Other countries only count deaths from COVID. In hospitals, I've only seen patients die with so far. To that extent, I think more is more. And this is where we need to appreciate how each different country, we may want to weight things differently or just wait for that data. We know that the UK does count these, but Belgium, in fact, counts them even more generously. So being able to provide these details on a regional or national level will be essential for us to be able to properly calibrate this data. I mean, I think the data is, it's important to have that, but indeed, it's also one of those places where it's, again, really important for us to have a code book and to be very specific about what kind of data is coming in. And frankly, that's just going to take time and work. So it said, do you think the analysis of individual data of COVID-19 patients will be deemed as a legitimate interest under the EU GDPR? Unfortunately, working at the Oxford Internet Institute, you become a bit hesitant to throw GDPR around because, frankly, there's just so many experts here who really know their stuff with respect to that. I am not one of them. I've explored some GDPR issues in my own work, but I really have to defer to my colleagues for that. I will say that all of the data that we are exploring here in our project is not personal info data. We're not down to the individual level, and we expect that any data that we will be using will be fuzzed or aggregated, and we have no interest in specific person data. For others, on the other hand, there may be obviously from a medical point of view, a legitimate interest in this, but I don't think that that's a legitimate interest in having all of this data publicly available, as much as it is ensuring that this data is stored securely and confidentially and available for researchers under very careful conditions. Adam, would you like to jump in on that question as well?
There is a question I would like to answer, and this is, sorry.
Actually, I was going to say, why don't you take the next one?
Excellent. Thank you, Bernie. There's a question. There are there strategies to ensure the quality of the data collected? And this is a very interesting question because we have to define the quality of the data. What do we mean by that? On one hand, do we mean that the data truthfully reflect the situation on the ground? That would be one question. Or the data is reflected correctly from the official sources. So for that, we are trying to approach it in two different ways. One way is we are writing letters to offices for national statistics, and we are developing a relationship with those offices. And slowly, in this department, the wheels turn slowly, and we are getting some responses from them. So we hope and we aim that in the near future, the data that is scattered around in different forms, Twitter, GitHubs, etc., will be collected and will be sent to us, to Oxford, and we will be able to publish it in a unified format for other people to use, and this will be an official data. It doesn't mean it's going to be reflective of what's going on the ground when it comes to pandemic, but at least in that sense, it's going to be correct. It's going to be official. Now, in terms of what we are doing right now, apart from developing relationships with offices for national statistics in many different countries, we are making sure the source of the data, so in the table, in the schema, we are making sure that we do not aggregate and use our own in-house rules, but we are clearly identify the source of information. So if the source of information at some point becomes clear that it's not reliable, at least the person that uses the database can clearly identify what is the source, and it's up to the user to decide whether it's good for their analysis or not.
So continuing through these questions here, I do want to just nip right to one here from Professor Lucy Huberman. And unfortunately, I want to say that at the moment we are not, I myself am not in touch with anyone on the SAGE committee, but I do welcome anyone who wants to speak with me about my experience with data collection, more so than data analysis, and for that I would defer to Adam and our other colleagues who are really skilled in that. And speaking of that, we have moving down through the questions, we have one that says, linking many data sources together for digital tracing, like in South Korea and China, seems to have helped avoiding lockdowns as much. What do you think the future of these approaches will be? I think the future will be exactly as we're doing, which is to say they will involve open collegial efforts from scientists and other members of the public. For example, at the moment, there is a extensive and mostly in good faith discussion on the GitHub or on GitHub of the imperial modeling algorithms that have been used there. And here we have, I've never seen a discussion like this on GitHub, where we have scientists talking to actuaries, talking to physicists about whether unit tests or random seed numbers and all these things are available. And this sort of collaboration is what I think is necessary for this sort of work. Now, as for triangulating the numbers, yes, but the problem is cleaning that data. Because as we, as certainly as my students have experienced, wrangling and merging data together is a real trial and requires a lot of care. So this is yet another appeal for open data standards, for open access to data, and not because we're wanting to share things that shouldn't be shared, but we want to be able to reveal what we can about data quality and how we can harmonize on those. Even little things like, should we use 2-letter country codes or 3-letter country codes? Stuff like that can just slow things down a little bit. And the more unified an effort we have, the better we'll be with that. So moving now down to the next one. It's from Joyce Yang. Hi, Joyce. Thanks so much. In countries such as Japan, data protection laws have been altered, amended to allow for the collection of online data to be used for COVID research and tracking. We've seen many Asian countries that have taken this type of approach to achieve better results. Okay, than their Western counterparts. It may create a precedent, and so then we're, and this is, I guess, what some of name check Naomi Klein and the notion of the shock doctrine is that during times of crisis, do we shoehorn in rules and regulations that we wouldn't otherwise in times that are outside crisis? I first want to take a little bit of a step back on that question, because we do know that other countries have had very rapid responses, but we don't necessarily know that that's because of their data analysis efforts, so much as other efforts for things like staying at home, wearing masks, social distancing. We are absolutely confident that social distancing works to stop the spread of this, although it's now, of course, a matter of at what cost and to what extent. But I do not think, and this is another question here, what's your own take on the privacy question I posed? I do not think that we need to sacrifice privacy to an extreme extent at all. In fact, I think a lot of colleagues here at Cambridge, at the Turing Institute, elsewhere in the UK, we've seen some really exciting work on how to use privacy-enhancing technologies to get statistically reliable estimates without needing the sort of privacy-invasive work available otherwise. I think that these things can work in harmony. And as I pointed out in my talk about how people must feel a sense of ownership or empowerment if you want good data, we can't separate these things. We can't do this at the expense of privacy, because certainly in a free and democratic country, you will see reactionaries see a sense of suspicion to this, and that will just undermine the data quality. So why should we rush to invade people's privacy only to have them try to subvert our data, rather than see about how we can jointly, collaboratively put together the sort of high quality data that we need to make the findings and ideas available so we can make better decisions. Okay. Adam, would you like to add anything and jump in at any point, I suppose?
Thanks, Bernie. I see a few more questions down the line that are, I could potentially comment with more authority than on the previous ones.
Yes. Oh, go for it.
Perhaps the question, what do you think are the main defects of the UK's collection of data in terms of coronavirus? It's probably, this question can be framed in a more general context. What are the sort of defects in general of the different countries providing this data, providing data on coronavirus? Are incredibly imaginative ways to share the data with the public, and the variety of different ways, and not only variety of different ways countries share the data with the public, but also this is a function of time. They constantly change. and this creates problems for people that want to do the analysis. They also change retrospectively. So as new information comes, they realize, okay, there were mistakes. Like there was one of the examples is Brazil that updated the data backwards quite substantially. And also we have a division. Countries are divided according to some administrative division, but this is often countries have a report cases not for the administrative division, but for the health division, and they do not overlap always. And that creates sometimes problem when wants to do the analysis for a concrete region. So additional assumptions must be put into place. When it comes to specifically for the UK, I think UK caught up in time in providing tools and more granular information on COVID. There's also this periodicity related how one needs to understand how the data is actually shared. So there's the weekend effect. It's not always published, and some countries wait until Monday. So all those things one need to be aware of, and not only take the numbers as they are. So that would be my general comment, a bit vague.
So I'll take the next question. And so it says, when looking at registration versus recognition, China is certainly in the recognition side as an authoritarian country. And indeed, we do have evidence of certain provinces already taking up facial recognition with gusto in a way that is not the case at all in Europe. Do you have any element about the Chinese discussions about their COVID statistics? I really wish I did. Unfortunately, I don't. I will say that as we do have knowledge of extensive history of the Chinese population seeking to subvert or otherwise get around certain data sharing apparatuses in the past. It's a sort of open secret that individuals in China want to use or will use VPNs in order to escape what's often called the Great Firewall of China. And to that extent, again, it's a matter of the more one tries to take this as a surveillance task, the more you will expect some subversion of that task as a part of it. I'll take this question from Hannah next, and hi Hannah, and then maybe Adam, you can take the one to you above it. So it says the use of the NHS-X app for research is being conditioned on the premise of anonymized data. So even if you anonymize the data, once you take an individual's top K most visited places, the majority of the data can be de-anonymized. Do you see this as an issue with anonymizing location data? There are two responses, two approaches to this. I don't know that I'm totally happy with either of them, frankly, but I am not part of the NHS-X team. They have not consulted me. The first response is the sort of fuzzed approach, and this approach, I recall colleagues like Daniela Quercia exploring this many moons ago, and I know that Facebook have put this in place with their web traffic data, and that is you do things where you sort of create synthetic populations so that the distribution is exactly the same, but you don't actually get the granularity that you would with just regular data. So you get maybe 100 people to represent one person, and because it's so fuzzy like that, when you do the average, it all looks out the same, but you can't actually pinpoint people. I'd like to see some approaches like that. But the other one is whether we believe that we have a social contract here. Now, in some of my other work, and certainly in that work that I mentioned in my Network Canvas paper, that data is not anonymous. And that's very, very sensitive data. We have data on people's risky sex practices and their drug practices, as well as the names of others that they're with. So what we've done is we've used institutional levers to guarantee that. In the US, it may surprise some to know that there's a thing called a certificate of confidentiality. Now, I'm not from the US, but I'm working on some colleagues with that there. Now, the certificate of confidentiality is a very important policy instrument because it means that the data can't even be subpoenaed by the Supreme Court. Which is to say it's one of the levers of trust that's required. As I also showed in the presentation, someone very skeptical about data vis-a-vis the advisor Dominic Cummings, if we give a population a reason to mistrust this data, that lever of confidentiality becomes a whole lot harder to pull. And then we have to go to anonymity. And so I do wonder, and I do worry about whether we're able to inspire the sort of trust in the public to say that we can keep that data secure. I think in some cases it's inevitable, and certainly for a lot of health data, we have to have data that is granular. And so we have to ensure that we can inspire the confidence in that through both good secure practices and operation security, but also through smart policy. I don't really think that there's a third way. We either fuzz the data or people have to trust us with it. I guess the third is just not to collect it. But gosh, those are very, very challenging choices. Adam.
Thank you, Jill, for the question. The question is, what additional data would you most want to obtain to add to your existing 5 data sets? Thank you for this question. So I guess with all of us, we have our preference, what we would like to, perhaps it comes from our the topic of our research we would like to see. This is to avoid a little bit, or to not to bring into my own biases. What we did with, for example, world and the European value surveys, there are over 900 different, or sorry, around 900 different features. I don't know if it's exactly over or just under, but around 900 features. We contacted economists, we contacted social scientists, and epidemiologists to help us to select from their background, from their point of view, what data they would like to see in a database like that to answer their own questions. And the reason, I guess my answer here would be, I would welcome comment. Please feel free to email me and let me know what would you like to see. I have my own preferences, but it's going to be only from my limited point of view. But if you think there is something that could help to answer certain open questions important for the society, please get in touch, and perhaps there is a data that we can fit with the framework we are building that would help scientists, students, or anyone else to tackle this sort of question and help us make it a little bit more useful for the research community, which ultimately that's the goal. Bernie, you have any question?
Gosh, so we're getting tight on time. I really want to thank everybody for these insightful questions. We'll see if we can follow up on some. But at this point, with 6 minutes left, we may have to go through a bit of a question blitz. And so I've been reading through some of these and trying to summarize them. So I will be a bit rapid fire, and I apologize, but let's see what we can do. Together with stats agencies, are you also developing relationships with media outlets or science journalists? I'll leave that to Adam, and we'll get to that in a sec. Is it useful to be comparing data between countries' trajectory if there's so many variables between different nations? Yes, it is. We can still see the rates go up. We can see the rates go down. The notion of a league table is a bit vulgar, and I think actually a bit insensitive, given the what's happening at the moment. But it is absolutely relevant for us to understand within country or within region whether particular initiatives have worked for that country or that region. Knowing, sort of like what Adam was pointing out, when did the transit stops close in a particular country? That can help us build a model that may not work everywhere, but will certainly help us understand in that population what had happened. Do I have any views on the Google Apple API versus NHSX model? Well, I kind of explored that in the last question. The Google Apple is more of the fuzzed, obscure data version. The NHSX is the more trust us centralization version. They both have trade-offs there. I am happy that the NHSX is the one doing the centralized data because they're bound by law and from the state in a way that Google and Apple, despite platitudes and not doing evil and stuff, are still motivated at a fundamental level by shareholders and stock prices and these sorts of things. I don't want to treat that in too much bad faith, but it does mean that it does change the liability profile. Okay, what do we got? If we could help the society provide citizen data to reduce the pandemic, how far should we go? Well, we should go as far as we can to ensure public trust. I mean, we're trying to ask people to behave differently. And we want them to believe that that different behavior is for their good and for the good of the society. And so if we go too far, then they just won't trust us, and they'll find suspect in that data. And that sort of breakdown in trust, we've already seen that happen throughout the world. I think most tragically at the moment in the presentations, anti-lockdown demonstrations in America, and to a lesser extent here in the UK, and even in other places like Germany. There's the matter of the care home data. And here it says care home deaths stating COVID or not be included in COVID deaths. I mean, that question's kind of out of scope for me. I'll leave that there for Adam in case he wants to speak to it. Unfortunately, I think I'm just going to have to myself finally ask one other really a nice question here from Professor Lucy Huberman, and that is, how important do you think it is for rapid public communication about the provenance and design of apps? I think it's incredibly important. We've already seen the almost like a feeding frenzy of attention towards Imperial's model on GitHub that shows real sincere interest from the public in participating from this. We also know that in our own work, the importance of informed consent. And informed consent is a performance, right? It's not a 17-page contract that people just like rubber stamp like terms and conditions. We understand that when we communicate effectively in an interview, informed consent, we do get that from people. And so we need to ensure that which we've already done, we've already ironed out informed consent as a meaningful aspect. In our own science, we continue, stay the course with that. I'll give the last couple to Adam here.
So there was one of the questions was about, together with statistical agencies, are you also developing relationships with media outlets and or science journalists? At the moment, we are not. That'll be a short answer. However, we are open if there is an added value to that, we certainly would consider that. It also the question of the bandwidth. We have quite a bit of things to do on the back end, and perhaps that's something we could consider in the future. What efforts, and this is a similar answer to the question, what efforts are being made to collect accurate data in low and middle income countries? This is a good question. There are countries where the data is clearly of lower quality, is not reflective of what's going on the ground. And there are some efforts needed to understand what's going on. At the moment, from where we are, we have a limited tools to attack or to tackle this problem. But this is potentially something when as the project develops a bit further into the future, this is something worth looking into. How we can, but the same question actually to countries that are developed, and perhaps this is the question about the accuracy of the data. How can we ensure that the data that we are having, although it's official, but perhaps it's inaccurate? How can we make sure that the data is reflective of what's going on? So this is a wider problem, not only to the lower middle income countries. Is there anything else?
Now we do have a very tiny number of questions left, but those questions, they're kind of related to some of the stuff that we've already spoken to, and we are at time. We want to thank everybody for sticking around right to the end. Thank you for the insightful questions and for your participation. I think both Adam and I are pretty accessible through search engines and stuff if you want to find our contact info if you don't have it already. I like to say that my inbox is always open, but it is of course a very complicated and busy time with COVID time dilation, as someone has called it. But again, I really thank you for your participation, and I just want to draw to a close there on that.